Welcome back, guys. Hi, guys. How are you? I hope you are all doing well. So, today's my topic of discussion is about the parietal lobe and its first part, which is primary somatosensory cortex. I explain where it is present, uh, their related pathways, okay, dorsal column medial laminuscus pathway, and corticospinal or corticobulbar pathway related to that, okay. And later on I explain the clinical importance of this area, which is primary somatosensory area, and when there is any clinical pathology related to it, what type of the features are appear in the patient, okay. So our topic of concern is about primary somatosensory area. I draw the beautiful brain. This is central sulcus of the brain. This is parieto-occipital sulcus. In previous videos, I explained all about related to frontal lobe, its cortex, its primary motor area, motor association area, and their frontal eye field, prefrontal cortex, and bulba, and one more structures also. So guys, please watch this video, okay, to clear the concepts related to frontal lobe pathways. Okay, so today's my topic of discussion is about this area, which is posterior to the central sulcus. What is this area? What are the name of this area? Okay, what are the name of this area which is just posterior to central sulcus of the brain? This is primary somatosensory area. Okay, if I draw this is the lateral view of the brain. Okay, now I explain you uh, to draw the which area of the brain at the level of primary somatosensory cortex. I have to cross section this area and see you the interior view, okay, and show you the anterior view of the uh, at the level of primary somatosensory cortex. So guys, first I draw the picture. Okay, this is brain stem, this is spinal cord, okay, this is the right side, and this is the left side, okay, at the level of which cross section area? Primary somatosensory cortex. So where is the primary somatosensory cortex? All this area is primary somatosensory cortex. Okay, all these areas are primary somatosensory cortex. Okay, so now I explain you what are the function of it, what are the two pathways involved in these in their functions of the primary somatosensory cortex. One of the pathways, dorsal column medial laminuscus pathway. One of the pathways, dorsal column median laminuscus pathway, okay. And what are the second pathway, which is spinothalamic tract. One is dorsal column medial laminuscus pathway, one is spinothalamic tract. Spinothalamic means it moves from spinal cord towards the thalamus, okay. Here I draw the beautiful thalamus structure in the brain, okay. Here is thalamus, okay, right side and left side. So what are the function of these two pathways related to primary somatosensory cortex, okay. What are the function of dorsal column medial laminuscus pathway, and what are the function of spinothalamic tract, okay. First function of dorsal column medial laminuscus pathways, these are all the sensory pathway because it goes towards the sensory area of the brain. Okay, primary somatosensory cortex. Okay, so the first function of the dorsal column medial laminuscus pathway is the fine touch sensations. Okay, fine touch sensations. Second function of medial laminuscus pathway, and third function of the medial laminuscus pathway. What are the first function of medial laminuscus pathway? Dorsal column medial laminuscus pathway, fine touch. Okay, fine touch, a little touch to your body is controlled by dorsal column medial laminuscus pathway. Second is proprioception. Okay, second function is proprioception, and the third function is vibration. Okay, our body vibrate, and the vibration, our body sense the vibration of maybe some mass is vibrate, and you can touch the vibration and your body feel that vibration. So dorsal column medial laminuscus pathway. Okay, it enters, I draw a little bit pathway of dorsal column medial laminuscus. How it enters? It enters in dorsal root ganglion. Okay, here is dorsal root ganglion, and enter in the spinal cord and move towards the cortex. Okay, before the cortex it cross the opposite side. Okay, okay, it cross opposite, and then it goes to the area of primary somatosensory cortex. Okay guys, remember this, it cross in the which part of the brain? Brain stem. Okay, this pathway, dorsal column medial laminuscus pathway, cross towards the opposite side, where in the brain? In the brain stem. Okay, but if I talk about this pathway, spinothalamic tract, what are the function of it? First we know the functions of it. Okay, what are the first function of it? Its function is crude touch sensation. Okay, what are the function of it? Crude touch sensation. Also the pressure sensation is controlled by spinothalamic tract. Okay, spinothalamic tract control crude touch and pressure sensation. Also important sensation, pain and temperature, are also sensed by spinothalamic tract. Okay, so these are the two functions. Okay, pain and temperature and crude touch sensation. What are the pathway of the spinothalamic tract? How it moves? Okay, it moves, spinothalamic tract enters in the spinal cord. Okay, and it cross in the spinal cord to the opposite side. Okay, what this is the important thing. Okay, dorsal column medial laminuscus pathway cross to the opposite side at the level of brain stem, but spinothalamic tract cross inside the spinal cord to the opposite side, and then go up towards the cortex. Before it goes to the cortex, it has to communicate with the relay center, thalamus, and then it goes towards the, where it goes towards the primary somatosensory cortex. Okay, so guys, these are all the pathway. Important point is the opposite. For example, dorsal column medial laminuscus pathway, my right hand. Okay, dorsal column medial laminuscus pathway, my right hand, proprioception, vibration, fine touch is controlled by which area? Left side of the primary somatosensory cortex. Okay, and from the left side of the body, right, some primary somatosensory cortex. Okay, also the spinothalamic tract also have the same function, but the difference is the axons which cross to the opposite side. For the dorsal column medial laminuscus pathway, it happens in the brainstem, but if I talk about spinothalamic tract, it crossover in the to the opposite side in the spinal cord. Okay, this is the most important. Okay guys, these are all the functions related and their pathways. Two pathways important: dorsal column medial laminuscus pathway and spinothalamic tract. So now I give you some detail related to it. with the clinical relevance. So first I explain the clinical relevance, and then I explain you some more detail related to that. Okay, so now I again draw that structure at the level of which primary somatosensory cortex. It's a coronal section. Okay, now my concern is this area. This is all area. We must know the blood supply of this area. Okay, what are the blood supply of this area? So here is internal carotid artery. Okay, internal carotid artery, which comes where from the aorta there are branches. Okay, right subclavian and right common carotid artery, and right common and left common carotid artery ascend towards the brain, and there is internal and external carotid artery. So this is internal carotid artery. Okay, what is this artery? Internal carotid artery. Okay, it gives the branches to the primary somatosensory. This is all the primary somatosensory area. Okay, now the blood supply. This area's blood supply is different, and this area blood supply is different. Okay, two areas. Okay, so what are the arteries name of this? What is this artery? And you must know that artery also. What is that artery? This is green color. Okay, there are two arteries, two branches from the internal carotid artery. Anterior, the red branch is anterior cerebral artery, and the green branch is middle cerebral artery. Okay, so what are the importance of these arteries? Guys, you know, the stroke, when there is stroke of the arteries, there is a blockage in the arteries. The arteries which innervate this area is damaged. Okay, when there is damage to this area, what are the clinical symptoms appear in the patients? Okay, so before this we know the area which control the specific part of your body. Okay, so all of this area I have to draw in. All of this area, primary somatosensory cortex, control the lower limb, lower limb of your body. Okay, and all this area, which I highlighted here in green, which is a part of primary somatosensory cortex, what it explains? Okay, it controls the your face. Okay, your face sensations, your tongue sensations. Okay, all the sensation, your upper limb sensations, all these sensations are controlled this area, primary somatosensory area. Okay, now here is two blood supply. One is the red one which supply this area. Okay, and second one in which I draw in green. Okay, so these are all the blood supply. So guys, what are the clinical importance of it? When there is any blockage in the internal carotid artery or the branch of the internal carotid artery, there the blood supply not go towards these arteries. Okay, if there is blockage in the anterior cerebral artery, there is a damage to this area. Okay, there is a damage to this area. What are the function of this area? It sends the lower limb. So the patient whose anterior cerebral artery is damaged and their function of the sensation of the lower limbs, your legs, your foot, is lost. So that patient cannot sense anyone hit at his legs, but he cannot feel the pain, not feel the touch, not feel the vibration in the lower limbs. In the same way, if there is damage to the middle cerebral artery, what are the area loss? This area, this area loss. Okay, this area loss. Okay, so what are the function of this area? Guys, you know the function of this area? What are the function of this area? It controls your face sensations and neck region sensations, your tongue sensations, and your upper limb sensation. All of these are lost when there is a blockage in this artery. Okay, so what are the clinical importance? What are the clinical features appear if there is middle cerebral artery damage? So there is a what are the functions? First we know the functions of it. Okay, there is a fine touch, there is a crude sensation, there is a temperature pressure sensation. All these are lost when there is middle cerebral artery damage. Any blockage, it cause the blockage in the artery, cause the upcoming structure are damaged, ischemia and infarction and damage. Okay, all the facial sensation, all the tongue sensation, all the upper limb sensation are lost if there is a damage to the middle cerebral artery. And if there is a damage to anterior cerebral artery, the sensation from the lower limb is lost. So if there is a sensation is lost, what happens? There is a motor activity? No. If there is a sensation is lost, the motor activity also not perform to that signals. Okay, so what are the important point? These are all the important points, and now I give you some like 5-star important point which is very very important. Guys, you know the structures of the brain. Now I draw the lateral view of the brain. Okay, this is central sulcus and this is parieto-occipital sulcus. Our today's topic is this area, primary somatosensory cortex, which I explain in detail its pathway, dorsal column, medial laminuscus pathway, and spinothalamic tract. Okay, all these pathway. And here is a pathway which is anterior to it is primary motor cortex. Okay, now I draw a little bit more structures. This is cerebellum. Okay, so here is some nucleus which is deep in the spinal cord and the brain stem. Okay, all of the motor activity goes towards this area. Okay, from the motor primary motor cortex which innervates the nucleus in the brainstem. What are the name of this pathway? Guys, you must know the name of these pathways. Cortico bulbar pathway. Okay, and the sensation which goes and the motor activity which goes deep in this area. What are the name of this pathway? Second one, corticospinal pathway. Okay, so guys, what are the important point? This sensory area participate also in the little bit motor activity. Okay, if we talk about corticobulbar pathway or if we talk about corticospinal pathway. Now you must know how many percentage it participate in these pathways. So this primary somatosensory cortex participate in the motor pathways is 40%. Okay guys, 40%. Okay, it involves. So guys, these are all about the primary somatosensory cortex, its pathways, okay, its functions, okay, and its relation with the motor area of the brain, which is primary motor cortex. Okay, so guys, these are all about primary somatosensory cortex, which is present in the parietal lobe. So guys, I hope you are all understand my video. Please made the notes in a proper form. Okay, I explain very clinical relations to these pathways. Also I explain the somatotropy, which is sensory homunculus. Okay guys, one more thing, what are the homunculus of the sensory and what are the homunculus of the motor? Okay, homunculus is just the area. Okay, in previous picture I explained the area where the arteries are supplied. Homunculus are just that area. Okay, so if there is a sensory part, there is sensory homunculus, and there is motor part, there is motor homunculus. Okay, sensory for sensory homunculus and motor homunculus. Okay, so in previous video I explained also the motor homunculus in the motor primary motor cortex explanation. In this video I explained somatosensory area, primary somatosensory area, so I explained the sensory homunculus. So guys, I hope you understand this. So guys, be happy and please like, share and subscribe my channel, and please press the bell icon for receive any new video, any informative video, and support me guys. So be happy.